Welcome to Code Gray, the evolving landscape of healthcare IT. I'm Scott Strickler. I am moderator for the day. I'm Director of Marketing for ISG Technology, and we're just happy that you're here sharing your time with us today for should be a great panel discussion. A few housekeeping items real quick. Everybody's audio is on mute, but we want this to be as interactive as possible, so submit your questions via the chat should be on the right-hand side of your GoToWebinar panel. We are giving away an Oculus Quest 2, so answer the poll questions throughout. There's 3 or 4 of those, and that'll enter you into the chance to win the Oculus. And why do you want an Oculus? It is because you get to, if you have children, you get to see them do fun stuff like this, like my children do. So gotta love that. There is also going to be a survey at the end. Please tell us how we did. That helps us understand what topics we'll also be talking about in the future as well too. So please answer those questions if you can. I will get to our presenters in just a sec. I noticed we have quite a few new folks today, so I'm going to give you a quick little intro about what we're talking about, as well as a little bit about ISG for those of you who don't know us that well. But we will be kind of covering the evolution of IT in healthcare, security threats and how we're preventing them, what to do in ransomware strikes, and preparing for the future of healthcare, which includes a cloud discussion with some of the expertise that we have in this panel. So it should be a good discussion today. A little bit about ISG for those of you who don't know us. We're 4th generation family owned via our parent sister company, Twin Valley Telco. Been around for 75 years with them, Midwest through and through, 3 states that we cover with 8 locations, Missouri, Kansas, and Oklahoma. Over 150 employees, with the good portion of those being technical and staff, and 2,000 plus clients across all different industries. Of course, we're talking about healthcare today. About 20% of our client base is actually in healthcare. So quite a few folks at our company that understand the healthcare world and work alongside of our clients to really just make healthcare IT better. At the end of the day, we're here to unlock possibilities for our clients. As a managed service provider, we do that with some of the managed offerings. We take some of the heavy lifting off of your plate as far as managing the network, the servers, storage, security solutions, backup, all the things that you see there. We actually own and operate 2 SOC 2 audited data centers. That's how we bring to life many of those managed services that you see there. And of course, what ISG has been known for 30 plus years is just our professional services and reseller services that we do across the board. Anything you can think of when it comes to IT. So at the end of the day, we just want to help our clients make great IT decisions and keep them operating smoothly. So let's meet our panelists. I'm going to unshare my screen here real quick. There we go. Give me a sec. And let's talk to Brett. You're actually top left for me. Brett is from Veamm. Can you tell us a little bit about yourself, Brett, and your work in the healthcare industry?
Yeah, absolutely. So I've been a systems engineer with Veamm for a little over 3 years now. But prior to that, I spent over 18 years as a system engineer in healthcare in the Kansas City area. So lots of experience, in the day-to-day operations of what is required to keep a healthcare IT operation up and running.
Awesome. Thank you, sir. Mr. Walter Herselkorn, tell us about yourself.
Obviously I'm with ISG. I work in healthcare as well as other industries, but healthcare is a focus for me on a certain level. I work with CIOs, CEOs, and CSOs, helping them develop their security strategies and improving their postures, along with keeping them abreast of what's occurring in the space. And the space is real time right now. So.
Yep, and Walter also heads up our incident response team, so we'll have a few questions for him related to that as well too. Steve from HPE, tell us a little bit about yourself, Steve.
Great. Hey, Scott, great. Thank you for the opportunity to be on the panel today. And I am with Hewlett-Packard Enterprise, and I focus on the GreenLake Cloud services for North America and focus on healthcare providers and payers. And so I've been with HPE now for a little over 2.5 years. I really spent my career in the healthcare provider space. Also, I'm an engineer by degree, and I've supported managed and led in executive positions, integrated health networks and academically affiliated health systems. So I have leveraged hybrid cloud strategies, we'll talk a little bit about today, to deliver some mission critical systems, including electronic health records.
Awesome. Thank you, Steve. Thanks for being with us. And last but definitely not least, Mr. Gabe DePaz, one of our clients for ISG. Tell us a little bit about yourself, Gabe.
Sure. Thanks, Scott, first of all, for inviting me. My name is Gabe DePaz, and I've been in healthcare for over 30 years. Similar to Steve, I'm an engineer by trade, so my career went from being an engineer developing systems, healthcare systems, to then becoming a CIO and leading those healthcare systems in the technology area. Currently, I'm the VCIO for Medical Facilities Corporation and working very closely with Oklahoma Spine, one of the clients.
Great. Well, thanks for being with us, Gabe. All right, we'll kick this off here. Wanted to first go around the table and kind of just talk high level, the evolution of healthcare industry for IT. So with the question being, what kind of challenges and opportunities are healthcare organizations facing today? So Steve, do you mind kicking us off for the challenges and opportunities healthcare organizations are facing?
Yeah, Scott, love to. So I'll tell you what really is on top of everybody's mind is the pandemic and how really that has changed the mode of operation for health IT. So as we have come through this pandemic and we try to shut the door on this, right, we have seen that we have, as health IT teams, successfully pivoted and delivered technology solutions that were absolutely imperative in a short period of time, right? And these include support for remote workers, telemedicine, digital front doors, and other solutions, right? We had to come to the table very quickly, and we did as an industry. So congratulations to those who support health IT and the delivery of patient care services to your communities. We've done an excellent job. Really, what we have done though is because we all became aligned and we delivered these solutions very quickly, this is now becoming the expectation as we go forward, right? So maintaining this level of agility is the challenge for us, and doing this in a responsible way and an economically sustainable way is what the opportunity and the challenge we have going forward. And so the other one I'll just mention very quickly is data analytics as the opportunity, right? Organizations now are leveraging information we have captured in the electronic health record and delivering meaningful use over the last several years now, and finding ways to improve hospital operations, work smarter, not harder. This is absolutely a necessity. We see this as a tremendous opportunity, and leading healthcare organizations moving in that direction.
Great, that's fantastic. Good insight there. Gabe, how about you? What challenges and opportunities are you seeing?
Well, there's plenty of challenges, as you know, but like Steve was saying, with the pandemic, we kind of shifted the paradigm of healthcare delivery, right? Now their doctors are a lot more mobile. They can provide healthcare to a lot more patients. So opportunities, communication platforms definitely is one that I see, bringing the patient closer to healthcare, to the doctor and to the team. That's a great opportunity. But with that paradigm shift came the prospect of cybersecurity looming its head, right? Ransomware attacks and so forth. So the whole population has to be a lot more savvy with cybersecurity. And secondly, what happens, also the big resignation, right? So a lot of people are changing their work habits. And for the smaller hospitals and facilities, it's becoming a lot harder to maintain and keep staff. Definitely IT staff is becoming a premium, and is very hard to keep in place. That's one challenge. The other challenge is that facilities are usually focused on providing care, not technology. So their core business is not technology, is patient care. And with that, it makes it very difficult to keep those resources trained in the evolving technology patterns that exist. Now with cybersecurity, as you know, you cannot keep somebody that does cybersecurity in-house because they go to a company that does cybersecurity and they're trained and upkeep there. So that's a great challenge I see in the environment right now. I see an education challenge where a lot of the companies and facilities in healthcare, since they lack so much with the other areas, is that a lot of the companies don't know exactly where they need to go. So educating and providing that guidance is critical for facilities so they can become secure and they can be defensible with all these attacks that are occurring. So those are two challenges, and I agree with Steve. Analytics and AI is a future. That's the future of healthcare, but you have to take care of the things that are happening today to allow you to focus on those things.
Yeah, that's great. A good insight there. Walter, how about you, coming from a different angle, being on the service provider side?
So, yes, echo Steve, echo Gabe on everything they said. I see this somewhat from the outside looking in, right? So I hear the comments of struggling resources. That's the number one topic that I get. How do we secure our network? And then, the conversation changes from, well, where are you at? And usually the answer is, I think we're okay, but don't know, right? And that's the biggest fear that the C class has today, because to Gabe's point, these are healthcare providers and healthcare administrators. IT has always just been a sub-function of the industry, if you will, and it's become much more critical, particularly with the pandemic. And then when you get to remote workers and telemedicine, you open up so many doors to your network to make this happen. And how do you secure those? And those are I think, kind of the key challenges. Then financially balancing that, right? How am I not faced with a $3 million OPEX or CAPEX, right? How can I get this into OPEX so I can be a little bit more budgeted and understand? And you see this shift to hybrid technologies and cloud and all these other pieces, because that all ties back to one single factor that they deal with, which is ransomware. Every healthcare organization is petrified of ransomware, which everybody should be, but healthcare carries a much greater burden because of the PHI and information they have. But they have limited resources, and then you layer on top, get cyber insurance. And what does it take to get cyber insurance? 2 years ago, it really, I'm going to make a broad statement. It kind of, you could fog a mirror and get it. Today, to put it more in layman's terms, you're going in and getting a physical before that policy is issued. So there's no more pinky swear that, oh, we've got that, we're okay. There are now, I'm watching where underwriting is asking for true assessments and audits, proof and documentation. And now you're asking this from an industry that is been working in the HIPAA space, but even HIPAA doesn't encompass what cybersecurity really encompasses, right? They're similar, but they're different. So I would say those are the two biggest challenges that I see the healthcare industry, at least at the executive level, struggling with. How do I balance the funding, right? And how do I balance my staff? Because now, to Gabe's point, the great resignation, we see that fairly commonly, people moving and not to other healthcare providers. They are moving out to third-party security platform providers where those skills are needed. There's a void in that space. So obviously compensation is very good for them. And there's a certain amount of security with that role once you get into that.
Yeah, great. How about you, Brett?
Well, I kind of would echo a little bit, what Walter said, and Steve and Gabe for that matter. I think what I see is resources being the biggest challenge. Obviously staffing is a part of that, and also just from a budgetary standpoint, being able to afford the technology that is required to not only get the cyber insurance, but to have your organization in a place where you can meet the security standards that are required to prevent ransomware events and other malware, cyber attack activities. I think hospitals have traditionally been challenged from the IT side and from a budgeting standpoint. Again, Gabe mentioned they're in the business of patient care and patient outcomes, not in the business of selling IT services. So I think it's always been a challenge to have the IT budgets that are required, from a personnel standpoint and an equipment standpoint to meet those challenges. Specifically, when you're facing things like ransomware that has, increased, 400, 500% over the last 3 or 4 years, as, in an industry for healthcare. So, 45 million people, I think, were affected last year alone in healthcare based on ransomware attacks. So, obviously, you're affecting the healthcare industry's ability to care for patients in these attacks, but you also have the other side of it where patient information is being accessed, and those individuals outside of the patients are being affected by it as well.
The 12 controls that are needed for cyber insurance nowadays. I'm going to pull up a slide here for you. Can you just speak to what are the most important controls that folks need to worry about so that they can get cyber insurance, but also to protect themselves? So I'll put that up on screen here in a sec.
Sure. When you talk about controls, there are some very basic controls that can be put in place, and then there's some more elaborate type things. But from a basic function, multi-factor authentication, right? That's key, particularly with critical systems, right? The mistake people make is they put multi-factor on and they do it on their email, and that's super great. That's a good start. But what about your ERP or your accounting system, or the list goes on and on. We tend to, for convenience, not do that. And those are the things that people are really after, right? They want to get to your data. And so I would suggest looking at that. You've got endpoint detection response. That's a must-have these days anymore. That was a nice to have probably 4 or 5 years ago. It's a must-to-have now, and it's really the quality of that product. Do an evaluation, work with a company, work with your integrator, work with ISG, work with a vendor to establish which one works best for you. Make sure on your backups, right, that you're off domain, you're secure, you're encrypted employee, and I'm sure Brent will talk about this. The 3-2-1 rule, right, and maybe even the 3-2-1+1 is becoming a little bit more popular these days. Here's one that we haven't talked about a lot. We've done a lot of these sessions over the years. PAM, or Privileged Access Management. It's a new one now, right? It's a new requirement for insurance, cyber insurance, to get a solid policy in place without paying premiums. You're going to need to work with somebody. That does take a lot of work. There's different ways to can do that. You can kind of get there through conditional access as well. You can buy software platforms that do it. Email filtering and web security. Look at a platform that actually does that well. There's lots of them out there. They're basic things that can stop your end users from clicking links. Get a patch management strategy in place. I know those tend to take a back burner, particularly in healthcare. A lot of fires going on in healthcare during the day, right? Device goes down on the 3rd floor. IT person has to run up there. They were going to patch today, but the decision is made. We need to fix this machine so that we can continue patient care. Patching takes a back seat. So if you can't find the time, don't mistake having resources for those resources can cover everything that needs to be covered. That's fairly critical. They will get tied up in the weeds of a day-to-day activity. Get a plan. If something happens, what do? Don't make your plan to call your cyber insurance company and pay the ransom. That's probably not going to happen. Don't let that be your strategy. They still will not get your data. Statistics show most data doesn't come back, or the bad actors have left, as you will, kind of jewels in your files again to give them access in the future, right? Get a plan, work with a company, who to contact, what to do, and all those great steps so that it isn't a complete panic when it does happen. Train your employees. Number one threat in any organization is their own employees. Not because they want to be a threat, because it's human nature. I forgot my Amazon account is not linked to my, in my case, my ISG account. I know I don't get anything to my ISG account, but in a hurry, particularly, you know, with people working remote, it can happen, and it does. Review your RDP policies, right? Review those, understand them, and make sure that you're monitoring those and nothing gets slipped through. Monitor, get logs. We see this all too often in breaches. People get breached, logs tell the story. But if you don't have some sort of device that's capturing your logs, or you're not reviewing your logs, you're really dead in the water. You will never discover what caused your breach. It's virtually impossible. There will be 1,000 theories on how it could have happened, and all will be unproven, right? Make sure you're monitoring your inventory. Do an inventory every year. What devices are on my network? I've seen inventories where we've actually worked with providers. It will tell us there's nothing on our network that's out of date. I don't have any Windows 2003 or 2007 machines. We'll come in and do an inventory and tell them, yes, you do, you have 3. They will deny it. It doesn't lie, it's on your network. Really what happened, it was human error. Somebody was supposed to decommission and unplug it from the network. They didn't, right? Or they decommissioned it and never took it off the network for whatever reason. That's fairly common, particularly in robust environments, in data centers. And then a new one that we're really seeing now is the vendor and supply chain management. Really what that is they're asking and saying, are you asking your vendors, very, very key in healthcare, because there are so many different vendors with different devices that run different operating systems. Understand how your vendor is going to keep that machine updated and patched, and what does that machine really do, right? That is very critical because those machines are network attached. Do they have back doors? Do they service them? All those critical questions need to be asked today. They really weren't, I mean, they probably were a requirement 5 years ago, but it wasn't an issue. 10 years ago, it was clearly not an issue. So those are the things that when you're looking at, you know, cybersecurity, the top 5 today to help you get kind of your foot in the door: MFA, EDR, encrypted offsite, domain detached backups, get some sort of privileged access management in place, or some sort of, you know, clean your Active Directory. Everybody on the phone probably agree their Active Directory is not as clean as they'd like it to be. That's really the brains of your engine. I put more energy into keeping your Active Directory clean than probably is, and then make sure you've got the right filtering tools and scanning tools on your network.
Awesome, thanks. Hey, Brett, so backups are one of those items on the list there. Can you tell us, like, what % of healthcare organizations roughly are you seeing that have their actual backups in good shape?
Wow, that's a great question. You know, I would say in my experience, maybe 40% of the folks that I work with from a healthcare standpoint are really in a condition that I would say complies with the 3-2-1 rule. And just to kind of reiterate what the 3-2-1 rule is, that's 3 copies of your data, 2 different types of media, and at least, you know, one of those types of media being stored off-site. You know, we do actually, and Walter mentioned this briefly, you know, we do like to add, you know, some additional numbers on the end of that now, and maybe say 3-2-1-1-0. So that additional 1 being 1 copy of that data being immutable or air-gapped, and then the 0 being 0 errors. So what that means is that you are testing those backups, you know, making sure that those can be recovered. You know, have that, doing that on a scheduled basis, you know, maybe doing some disaster recovery testing in addition to that. So, you know, it's critical to make sure that, you know, you have copies of that data and that it is either immutable or air-gapped. And Walter also mentioned the importance of being off domain. That's something I talk to people about really on a daily basis is, you know, best practices, let's make sure all of these critical data protection components are off domain. In a cyber attack, I'd say typically, most of those are going for domain-based accounts. If all of your data protection is also based on those domain-based accounts, the chances of those being compromised are much greater than if that those machines and those accounts are all off of domain. Also just failing to test their plan. So most of the organizations that I talk to do have a quote unquote DR plan in place, but as far as those that actually test that, I'd say that's probably closer to 10%. So lots of room there for improvement. I think backup has never been something that's been overly exciting for people. It's been sort of a necessary evil over the years in case that big disaster came about. But I think folks have certainly learned over the last several years that you're much more likely to experience a cyber attack than you are something a natural disaster that takes out a bunch of your infrastructure. So while backups aren't exciting, they've definitely come to the forefront again as something that's critical to the business on a daily basis, and also being able to take advantage of that data, utilizing it from an analytical standpoint. So you've spent the money to house this backup data. Let's take advantage of that and use that in ways that can help the business. And then one more thing is the firewalls and intrusion detection and things like that are critical, but also you need a way to look at what's happening in your environment proactively. So you need a tool that looks at that data or looks at those workloads and says, hey, something's different today about what's happening in your environment. That backup typically has been 5 gig a day. Well, all of a sudden today it was 75 gig or a terabyte. You need analytics in place that looks at that type of information and gives you an idea that, hey, something's going on in my environment. So it's data protection isn't just about backups. It's also about some machine learning and the AI that's been mentioned that is taking a look at the data that you have out there and is giving you some feedback and information based on that.
Good, thank you. Gabe, how about you? As far as challenges when it comes to cybersecurity, ransomware, all those things. You've been healthcare CIO for many years now. How are you seeing it?
Well, what I see is that if you look at a lot of healthcare organizations, right? The first thing is they need to adopt a cybersecurity framework and follow it, right? They have to establish that and establish the proper controls that will keep them safe. A lot of the things that we do, I include myself because I've been there, is we love to be heroes. We love to save the day. We wear a cape, something breaks, and we go out there and we save the day, and we're heroes, right? And our job is to eliminate heroes. Our job is to have things that become just normal, right? And it's very hard within IT because there are so many fires all the time that people are addressing, and you want IT to become boring. The things that blocking and tackling that happen naturally, patches happen naturally, change management happens naturally, onboarding and decommissioning, your inventory control, all those areas need to become a routine within the IT framework, right? So what I find as a big challenge is that most of the hospitals and most of the areas that I work with, people know about them. It's not like they don't know I need to do this, but they have it in their brains. They have it in their minds. They don't have a formal process that they follow. They don't have a cadence of coming together and forming teams to review change management and what's going to happen. Do you have a backup? If something fails, how do you recover? What's your window of opportunity to make this, and when do you roll back? I mean, all those things that you do naturally, there's not a formal plan to execute, right? Just like Brett was saying with DR, right? People, if something happens, they know where they need to go, but it becomes chaos. There's no process by which they're going to come in. How do they communicate? Who do they communicate with? Who's going to do what first? What do you bring up first, right? And usually you find that when you have an outage, right? The data center, somebody did something wrong, the whole system, the whole company went down, right? Now you got to bring it up. So the first question is, what do we bring up first? What is the order of doing things? And people are guessing at the time, then they have to stop. So all those things, when you prepare on the upkeep of the infrastructure, the same way you have to prepare for the upkeep of cybersecurity. If there's a cybersecurity event, you have to have a roadmap. You have to have a run book that you just pull out and you execute, right? And then that to me is the biggest challenge in the world we live in, because it's not a matter of if you're going to get hit, it's a matter of when. And they're not, I mean, they're hitting everybody, right? Because it's easy money for them, right? What do you say? I don't know, ransomware as a service. Think about that, right? Where something like that is being weaponized against our industry. And people that don't know anything about coding or engineering are becoming businessmen using that, right? And they're making money at it. And that's a tough challenge that we have, right? And it starts with educating the people so they understand the gravity of it. And like anything else, when you deal with this risks, is like insurance, right? Is thinking, I'm in Puerto Rico right now. You know what? The chances of a hurricane hitting the island are much bigger than South Dakota, right? So I need to be prepared, because it's not whether it's going to happen this year, but it's going to happen within the next 5 years, sometime, right? And it could be catastrophic. The same thing that same approach you need to take to protecting your healthcare information, your PHI, your patient information, and your systems, right? Because the last thing you want is to get a ransomware attack when you have somebody on the table, right? And things stop working and the data is not accessible. So in healthcare is a different animal in that when we talk about healthcare and we talk about IT and we talk about anything, it all boils down to patient care. How do we protect that patient? How do we take care of that patient? How do we facilitate the care of that patient and the experience of the patient? And IT makes up a big part of that. But that's the foundation. And how do you do that? And when you talk with the executive team, the CEOs, the CFOs, you have to formulate what you need based on your risk and what is the impact to patient care and how do you mitigate it, right? And how do you take yourself out of a weak position and put yourself in a better position to evolve and provide them with a lot more capabilities to make a difference. Analytics is a great one, right? Analytics, we've digitized information over the last 10 years. Before, it wasn't digitized that way. Now, what do we do with it? How do we leverage that? It's a great opportunity. And the challenge that we have right now is that hospitals and healthcare facilities don't have the manpower to man that, the expertise to do it, or the budgets to hire the people, train them, and keep them so they can execute that. So, I see healthcare evolving. I see things moving more to the cloud. I see things that you're having infrastructure more as a service and networks as a service. All the things that you need a lot of skill set and upkeep, those things are going to become more of a thing, like Walter was mentioned, that is part of your OpEx. And then the people that you have in your hospital, on your facility, are the people that know the applications that you're running, that can keep a computer up, that can do all the things that they need right away, but where a lot of that expertise and the upkeep of that bench has to happen is in companies that focus on that and let the people do healthcare focus on healthcare.
Awesome. You officially made everybody jealous by letting us know where you were too, by the way, Gabe. So kudos to you though for having a nice sunny background behind you. So hey, we did get a question for the group here. It says, with the fall of Bitcoin, will ransomware be less prevalent without a safe, decentralized currency? I'll open that up to anyone who wants to tackle that one.
Yeah, this is Steve. I probably not. All right, I think you know, a lot more ransom money has been collected in U.S. dollars than ever was collected in Bitcoin. So that's not going to be something that affects that. You know, and I'll say this, right? The 2020 and 2021 were banner years in healthcare for breaches, right? So Office of Civil Rights tracks that. You have to register it. We're tracking to be over 700 in 2021, right? Breaches of over 500 accounts in a year. If you look at who's on that list, it's small, medium, large. Some of the most well-funded, most sophisticated integrated health networks are on this list. So to Brett's point, you might as well just plan on being breached and then have a method to recover from that, right? And well, the other part I'll just say, and Gabe mentioned this, is that there is, through a study through Poneman Institute, right, that hybrid cloud strategies are a better way to mitigate costs and risks associated with breach. That may not be intuitive. I'm really happy to follow up on this, you know, another time, but absolutely ways to mitigate risk with breaches is with hybrid cloud strategies.
And it is. So what can healthcare organizations do to prepare for the future, right?
Yeah, I mean, great question. And so, you know, what we've seen is, you know, healthcare organizations and health IT make tremendous strides in the past year, certainly through the pandemic. We touched on that, certainly through adoption levels of the electronic health record, right? And this was in support of American Recovery Act and high tech. But the fact is that there's still a long way to go for us. And, you know, today's our healthcare really delivery system is, you know, is unsustainable to a great extent in terms of cost. You know, we really average higher than the top 25 nations, developed nations in the country. Our quality of care is, you know, not where it should be, and even our patient satisfaction level. So it needs to improve, and we as health IT professionals and teams and organizations need to innovate. And so we have the opportunity to simplify health IT and move faster, to be able to support projects faster, support, you know, again, the demands that came out of predictable situations like COVID, and really reduce the costs associated with healthcare. And this is not just reduce cost in health IT necessarily, but this is reduce cost for the organization by perhaps delivering IT capabilities. So, you know, hybrid cloud really is the underpinning to deliver those type of innovations. And that is really how we move faster, how we simplify, and how we're able to standardize on delivery of technology in a meaningful and very productive way. So I'll leave you with these thoughts, you know, just as I really finish up here, is you know, health IT, and especially infrastructure teams, right? They are essential to the successful delivery of cloud enablement within the healthcare providers. And so this is especially when we talk about infrastructure as a service and platform as a service offerings. And so those team members and those folks are key to the delivery. The other part is that our industry is evolving. And so cloud services, right? We have a certain amount of success with that, right? We all hear about it, you know, and read about that. But the fact is, the industry is evolving to the point where, you know, these cloud services, you don't have to go to them. You can have them brought to you inside your institution, in your colo, right, in your ISG data center, or in your on-prem data center. And so this is the evolution that's coming on to help address and bridge the challenges that we see within healthcare, because we have some specific challenges, and we're you know, processing, you know, and it needs to be close to our data. Our data resides at the edge, right, where we are covering a lot of ground regionally. And so these are solutions that help with that. And the last I would just say is learn more about your about hybrid cloud strategies, right? I challenge you to look where other industries are going, how they have been successful, how this really foreshadows how the healthcare industry can innovate, and really get learn more about that, set strategies that are appropriate for your organization, and be ready to move forward to innovate.
Do you find that healthcare organizations, with just the critical nature of patient health information and electronic records, is there a reluctance to go to the cloud, or what's your take on that?
Yeah, that's a great question, right? So what we find is, and the reality is today, is the majority of electronic health records are deployed on site today. And there are reasons for that, right? Because you want to have integration between the components that support the health record, both from order, clinical documentation, order management, to clinical imaging, and PACS to document management. Right? These are all integrated to have to work seamlessly and very productively to provide care to clinical staff, medical staff, and so these, right? Many of these, most of these reside on site. Now, what happens is that there are companies like HPE where we can bring the cloud experience and the value of that, right, to organizations who have a preference to keep this on site in their data center or in their dedicated colo. So yeah, there is a great rationale to address the unique demands or requirements for data gravity that we have in the healthcare industry, but also avail ourselves, right, of the cloud experience. These are things that you do to have pooled resources, pay only for what you use. This is some of the attributes of cloud that now can come to you.
Awesome. While it's relevant, while we're talking about the cloud, I'm going to launch. That's what my next poll question is about. So let me launch that real quick. I'm going to get your reaction to this, Steve. So where are you in your cloud journey? Are you all on-prem and content with that? Are you underutilizing the cloud in your opinion? Or do you have a good balance of on-prem and cloud solutions? Or are you just in need of a cloud strategy? Steve, what do you guess? What do you think those results are going to be with your experience?
Yeah, so healthcare is leaning into this and leaning forward now, but we are tailing other industries for embracing cloud strategies, right? And because it's a challenge that we have. So what I could also share with you as we think about this and get the answers is that, again, I mentioned early on I had the opportunity to leverage on-premises cloud to support an electronic health record. In this case, it was an Epic system health record. And so what I could tell you is that through that exercise and through rebalancing the workload amongst our technical team and our broader IT team, right, we're able to address other significant requirements that helped our community, helped our delivery system. So, we became the second largest instance of HEMS Analytics Stage 7. This is a measuring stick for integrating the delivery of care with the electronic health record. And so what I can tell you is that we're able to do that at a productive manner and scale because we did rebalance and leverage
cloud. What else are you seeing as far as what people need to do to prepare?
So yeah, I mean, Steve's comments were great because it does dovetail into the conversation, right? Everybody needs a roadmap, and part of what I see most frequently is not understanding where you are today. So building a roadmap from not understanding where you are today is very difficult, and I've watched people try to do that. My advice is somewhat twofold. Go establish what you have. My recommendation is get a third party to do it for you, primarily just because of speed and time, and you can get those results fairly quickly. And being third party, they have no opinion. They're not trying to defend anything. They're just reporting, the news, so to speak. The second piece of that is then take that information, and what I see all too frequently is the lack of connection between the IT staff and the technical resources in healthcare and the financial administrative side of the business. There's is generally a complete disconnect in that the financial end of the business does not clearly understand what it takes to operate a solid infrastructure, and it makes it a challenge. And bring those two groups together. I think Gabe alluded to that kind of the talking amongst yourselves and understanding where the direction is, not just from a technology standpoint, but also financially. And what does that do long term? And hybrid cloud is clearly part of that strategy, or should be, right? There's some leverage that you can do there. That kind of marries a couple other conversations into that as far as cyber insurance, because financial side of the business saying we need to find something to mitigate risk, which that should not be your strategy, is get cyber insurance to, that's your ransomware response program is cyber insurance. But it is a necessary piece of the equation these days. But at least once you're talking across the fence, if you will, to each other, you can better understand the demands. There's a better planning that can be put in place. It can be structured, and you can work with somebody to identify what are the critical things that need to happen today and what can be planned over time, right? Some of these are not the easiest things to do, particularly if you're well behind the curve. And just knowing, the comments about ransomware not going away. I don't foresee it going away either. One of the latest trends right now are hackers targeting insurance companies to find out who their policies are written for, because that gives them the ability to get, if you will, a lead list, right? They have a prospect list where they can start delivering. And while most attacks are what I would consider broad net throws, if you will, and less targeted, they're going to still find you if they find a company and they understand that, oh, there's 6,000 policies right there. That is 6,000 people or companies that are potential targets that they can go after, right? And it can be a payday out there. And also helping them understand what their policies cover. We've been in a number of breaches where the leadership team said, oh, no problem, we have cyber insurance. When the rubber hits the road and the insurance policy, they have to actually make a claim, what we find is they didn't understand the policy. They can no longer work with ABC company because the policy dictated that they have to use a captive company that the insurance company is affiliated with, typically owned, right? They find that what they thought was going to be recovered really wasn't going to be covered. There's a lot of stages to a breach and recovery. It's not as simple as just go rip and replace. Right? They start to realize that there's still cost associated, and many times it's in the hundreds of thousands or millions of dollars to bring your network back up and running. And those pieces all fit into that roadmap, and also, oddly enough, fit into that incident response plan. Right? If I need to respond, I know these things can happen. My level of comfort is better. So those are the things that really need to be. And then I would hold yourselves accountable to, if nothing else, a subset of 5 controls that we talked about earlier. The goal in cybersecurity is to make your network, I don't want to use the term so complex, but to make your network a little bit more challenging to penetrate and move on to the next, right? Because a lot of breaches happen because of simple stuff, unpatched things, untrained employees. And it's really not, some guys in the basement trying to crack some code to get into your network. Those are extremely targeted and effectively fairly rare, because we really find more in the hacktivist environment, if you will, and not the ransomware gangs. Those are my thoughts around it, Scott.
Yeah, great. Looks like we've got about 5 minutes left here. Brett, Gabe, any either parting words or just what can CIOs do to to prepare for the evolving world, as you mentioned, Gabe?
Well, one of the things I see, and it's a challenge in hospitals and other facilities, is that there's a technical debt that exists, and as they look to migrate and bring new technology, they're always hitting against that technical debt, right? And one of the key areas there is how do I take the people I have and leverage them, and let those things that it's just overhead, it's just taxing my environment, and offload those so that I don't have to be an expert in every part of my system, and I can focus on those things that I need to. And by doing that, you can offload a lot of it and then focus on what works best for your facility, right? The part of that is, how do you look to newer technology to make it more efficient, to build opportunities for the facilities to leverage what the future holds, right? And not stay behind the 8 ball. And the dance of doing that with a lot of debt that you're carrying, right? So for that, you need that plan, you need that roadmap, and you don't have to do it all in one day, but you have to have a roadmap that'll get you there, right? And have a goal. And first goal is to protect yourself, protect what you have, right? Ensure that your people are educated and know what they need to do and how to react to a cyber attack or any other incident, and then move on to the other areas and look for partners that could help you get there sooner, right? You don't have to do it all. Look for the right partner and build that roadmap to get you to the future state.
Nice. Go ahead.
And I know we're close on time, guys. I'll throw out two final thoughts really quick for me, and that is, as you're traveling along your cloud journey, I see that a lot of you feel like you have a good, healthy mix. Make sure that you are protecting that data that's in the cloud. A lot of people assume, hey, this is protected by this particular vendor. Make sure what you have there, make sure that data is well protected. In a lot of cases, you need a backup of it. They may have some archive protection, but if you need a point in time recovery type functionality, that's probably something they're not providing. So make sure you're covered there. And secondly, make sure that you have a means in place of testing your business.
All right. Well, hey, gentlemen, I just want to say thank you for joining the panel again today. Your expertise is fantastic, and we look forward to chatting with you guys in the future again. So I don't see any other final questions that have come in. So we'll adjourn with 2 minutes left and call it a day. Thank you, everyone.